Hi, this is Jorma Kaukonen. You're listening to WMNF Tampa 88.5 FM Community Radio, Peace Radio.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Good morning to you, my worthy friend and trusted listener. I can almost see your aura in the oscillation of the radio waves. Thanks for always keeping your dial tuned to WMNF Tampa, your resistance radio station from Tampa Bay to the Gulf of Mexico, and the only community-supported radio station that Thomas Hewitt Edward Cat would ever listen to. And you can listen to us 24 hours a day at WMNF.org. Well, goodness gracious alive, it is Ask Me Anything Monday. So listen up, my friend. I do not ask for much in this life, but today I would like you to call into the Healthy Steps radio show. Share your medical questions, comments, and concerns, and let's keep my favorite phone boss extraordinaire, Sage, busy this morning. Just give us a call at 813-239-9663. That number once again is 813-239-9663. You can also send an email to dj@wmnf.org or text us at 813-433-0885. Good morning to you, Dr. Harvey. I hope that you had an awesome weekend and that you are now ready, willing, and able to direct us through another AMA Monday. Your dedicated listeners have waited a week for this moment, so let me burn some shoe leather and get out of your way. What is the lay of the land today, Doctor?
Happy Monday, Bill, and boy, it was a glorious weekend, wasn't it?
It was indeed. I loved it. I got a little bit of cool in the morning and warmth in the afternoon. A great spread for Florida.
Indeed. I was really fortunate to be able to go on a really nice nature walk on Saturday morning. A wonderful man named Jeff Weber, who is a show listener, who also worked for the County of Sarasota for 30 years doing preservation of green spaces. And he took us on a walk through the Old Myakka, Miakka Preserve at the end of Fruitville Road. And we got to see all kinds of wonderful native plants and a couple species of Florida's blueberries. And that was really exciting because they're all in bloom. I plan to go back in about 2 months and have a couple of blueberries.
That sounds like a great idea. Very tasty.
Yes. And so, a lot of people don't know that blueberries actually live in Florida, and they've used these really interesting little natives to crossbreed with more commercial varieties to get bigger fruits, because the little BBs that the little black BBs, essentially, that the Florida fruit is like, there's a very little fruit. It's like totally a little antioxidant ball. But yeah, it was really a nice day. And then yesterday, again, got some nice walk on the beach and some relaxation out there because it was so beautiful. But, there's always something new in health and in medicine. And I was just reading a bunch of different things, and they kind of came together in a funny way. I saw that the American College of Cardiology has decided to do some new guidelines for cholesterol testing. Many people think that cholesterol is a disease, and many people wonder what maybe the symptoms of high cholesterol are, but there are none. That's the worst part. Cholesterol is a symptom itself, a sign of another problem. That problem is inflammation. Inflammation actually really affects all of our systems, and that is the way our systems break down and cause dysfunction, symptoms, and then diseases that might get labeled. And so, the College of Cardiology decided that since Americans are subjected to a toxic diet constantly, that cholesterol responds to toxicity and toxic diets, And the problem is that younger and younger people are getting higher LDL cholesterol, and so it needs to be looked at earlier, they say, because they know that epidemiologically, meaning when you look at great populations of people, the higher the cholesterol, the more risk for heart attacks and things like that. But that's the, Western medicine illness directed thinking driving this description, because Western medicine needs a label to treat. So cholesterol somehow got a label, even though it's not an illness, because it's associated with other illness. And so, we spend a lot of time and money studying cholesterol itself and how to actually change the level of cholesterol in the body. Statin drugs are amazing at reducing cholesterol levels. There are other medications like ezetimibe, which prevents absorption. There's a bunch of different things, but there are some diseases that promote it. Diseases that are associated with inflammation, chronic kidney disease, chronic liver disease, diabetes, HIV/AIDS, hyperthyroidism, autoimmune diseases like lupus. Hyperthyroidism tends to be mostly autoimmune, obesity, and sleep apnea. All of these things can help to raise cholesterol medicine or cholesterol levels. And all of them are associated with inflammation. So it may make some really good sense to back up and look at inflammation, because preventing high cholesterol is really not that hard. The first thing to consider is, are you eating a lot of stuff in boxes? If you're doing the processed food thing and you're eating things that have multisyllabic chemicals as part of the constituents that weren't something that the plant itself made, that it was made in a laboratory, you have to wonder, is this something that should be in my body? If it's got BHT and BHA, it's got glycerin extractives, mono and diglycerides, all kinds of other chemicals, including all those artificial sweeteners, colors, flavors, dyes, anything that has an FDA certification, you must understand that's likely to be toxic. Because if the FDA has to get involved, it was made by a chemical plant, from a petrochemical, and not from something natural. Although, petro is natural, but it's meant to be like staying in the ground as kind of lubricant for the tectonic plates. We're not supposed to be burning it, I don't think, but we're turning it into plastics. But it is those specific things that induce the changes that cause elevated cholesterol. Exposures to plasticizers, herbicides, pesticides. These occur in your processed foods and in your non-organic foods. First rule of thumb for eliminating high cholesterol is to eliminate the toxicity. Get rid of your ultra-processed foods. Get rid of anything that's not organic and contaminated. So you can make it more cost effective by using the Dirty Dozen and the Clean 15. Google that. I've talked about it a million times. And use those guidelines, because you don't have to buy the Clean 15 organic. So you can save some cash there, but you should always buy the Dirty Dozen organic. You don't want to eat local blueberries, peaches, strawberries, or tomatoes if it doesn't say organic on the label, because they're causing elevated cholesterol, risk for glucose mismanagement, and eventually diabetes and other autoimmune problems. But the reason I ended up on this little pathway is that I read a great article today in Vice. Cannabis compounds do something surprising to your liver, study finds. Yeah, cannabis compounds. Cannabis, that natural plant that's not a drug, but because drug companies like to make sure they get profit for their opiates, it's banned. We can't get easy access to it. And now it's controlled by corporations instead of just growing by the roadside where you can pick it and smoke it. But and in fact, there's a banned chemical called paraquat that America sprays on these crops, and it ends up in people's lungs because so many people end up smoking adulterated weed, because the people that grew it are not really concerned with your health. They're concerned with their profit. And so we really need to look at banning paraquat in this country too. It's deadly and it's killing people, and we don't need to be using it. But a new study from Hebrew University of Jerusalem, recently published in the British Journal of Pharmacology, asked a really good question. And the question was, do cannabinoids help to change the health of the liver? And in fact, they do. So cannabidiol, CBD, and cannabigerol, CBG, ameliorate fatty liver disease because they help to restore the fat metabolism in the liver. And it requires that you replace the phospholipids in the membrane. They make up most of the membrane. There's something called choline. Phosphatidylcholine actually makes up most of your cell membranes. And the place you get choline is from egg yolks, from soy and sunflower lecithin, and from eating organic liver, because it's really high in choline. These help to rebuild your liver when using CBD or CBG, according to this new article. It's really fascinating, and they have great graphics in the article showing exactly how this process works to fix fatty liver. Now, you have to remember, though, this is in rats that were fed, certain diets, and it actually, even though they didn't change the diet, these things helped. But the key is you have to change the diet to get the long-lasting, worthwhile effect. And so since we know these other things cause fatty liver, we want to look at those causes. And so if somebody has diabetes, you have to work on the diabetes. You're not going to get rid of fatty liver with CBD. If somebody has sleep apnea, you have to treat the sleep apnea because it causes it. There's no way to get around it. You might buffer it, but you're never going to cure it or fix it or return it to normal function without getting rid of the problem that's causing it. But you can support it very nicely. And there are a lot of places around you can get really good, high quality, full spectrum organic hemp products to help treat your body. You don't have to go to a dispensary because CBD and CBG are legal over the counter. And so I think it's really fascinating how these chemicals, which are actually something you don't even really honestly need the CBD, CBG, because it's actually the cannabinoids that hit the cannabinoid receptors in the body, and you make your own cannabinoids like anandamine, anyway, with good fats like omega-3 fatty acids, omega-9 fatty acids from olive oil and grapeseed, and from omega-6 fatty acids from walnuts and things like that. You can actually put together the ability to manufacture your own internal cannabinoids. You don't need the CBD and the CBG, but if you're behind the 8 ball, here's a way of actually increasing it quickly and really putting a buffer into your body. But I finally got around to the next level, is that because you're working on the fat metabolism in the body, you actually might change your cholesterol too, because inflammation raises cholesterol. And they have actually shown that the cannabinoids do change the way you metabolize your cholesterol, and they may actually reduce cholesterol, especially LDL cholesterol and triglycerides, which are the ones that actually are associated with the vascular effects and the fatty liver. So this is really important information that really, again, shows us that inflammation is the cause of so many of our medical problems. And there's so many ways we can address inflammation. But the first thing to do is get rid of the cause. Take it out of your lifestyle or your diet. Do you want to talk about this kind of stuff? I'm available right here, right now.
Indeed, you are there, Doctor, and we're very glad to have you at the Healthy Steps radio show here on WMNF Tampa. I've got 3 of our favorite and loyal callers, Jack, Gary, and Norm, on the line. But first, I want to remind folks, If you have any medical questions or concerns, give us a call at 813-239-9663, and you can continue to send your emails to dj@wmnf.org. But the magic number to call to get into the queue, and Sage will be glad to put you there and get you in a line to ask your medical questions or concerns, is 813-239-9663. Let's go to Jack. Good morning, Jack.
Good morning, Dr. Harvey.
Okay, let's see what happened.
Hello?
Sorry about that.
Yeah, Dr. Harvey, are you still there? Hello?
Hi, I'm here. I'm not sure I'm getting through to you.
Yeah, I can hear you now.
Good. So what you got for us today, Jack?
Yes, sir. I was, it's been about 6 months, I guess. My doctor my last physical, she put me on some kind of a cholesterol lowering medication because she said that I'm like insulin resistive, just, getting up there. And so I've cut out drinking sodas altogether, and I've tried to reduce sugar intake, and it seems to be getting better. And my last labs were a lot better. So I'm like right almost into the green area for whatever it is she's looking at. So
okay.
You said statin medicines. It's a long word. It's like rosuvastatin or something like that, 5 milligrams. And so I take that before I go to bed because she said that to reduce the cholesterol, you really don't want to eat. It's not one of the medicines that you want to take with eating. It's better to be, in kind of a fasting-like state. So it's better to take it at night. Is that true or not? Hello? Hello?
Hang on there a second. We're
okay.
Adjusting the airwaves here.
Okay.
You there, Doctor?
Hello?
Yeah,
Is it me?
No, we got you there, Jack. It's a technical error, and we're playing with it and getting everything under control here.
Yeah, I was just singing a Lionel Richie song. I was just joking with you.
Well, but as I was saying, it's always good to have you on the line there. Been a while since we've talked to you.
Yeah, true. So, but I was seeing something about a picture of a vein that's on the outside of your heart. They call it the Widowmaker, where there's like a Y branch, and that cholesterol seems to build up there. My question was, is cholesterol like a sticky substance that sticks to the walls of your veins, and is there something that can cause it to unstick? Because it's the thing that I was reading about said that once it sticks to the walls of your arteries, that it can harden up. It becomes stiff. And so I was wondering, is there a way, and is it dangerous if you do take something that, will knock off, big clogs of cholesterol? Can that in itself, cause damage? Does it float around? Or does it eventually dissolve back into your blood and you can somehow filter it out?
That's a great question. It talks about a lot of stuff. And let me go back to where you were initially. So you have insulin resistance, which means you have trouble metabolizing sugar. When you have insulin resistance, you end up building up something called triglycerides. Triglycerides tend to drive the production of LDL cholesterol. LDL takes cholesterol and triglycerides from the liver, where it's been processed, and out to the periphery to provide cholesterol and lipids to the rest of the body. When there's too much triglycerides, the body is using this methodology to store fat in your fat tissue outside of the liver. The cholesterol that's going out in the LDL packets tends to be used as kind of a spackle. Whenever you have inflammation in your heart arteries, you end up having an instance kind of like you've had an abrasion there. You've had some of the skin slough off the inside. It oozes. It's unhappy. and it wants to be whole. And until the cells can grow back in and fix that area, cholesterol sticks there and spackles it. So you have a smoother surface. But that's not good, because if we don't remove that cholesterol and we keep injuring the arteries and we keep laying down more cholesterol, you'll end up with a plaque. The plaque then gets rancid. The rancidity creates inflammation. The inflammation is coming from white blood cells that are attracted to eat the rancid cholesterol to get rid of it. And they end up getting stuck there, and it turns into a festering pus mess that over time gets calcified, because old wounds get scarred, and calcium in your heart arteries is scarred arteries. Coronary calcium scores don't look at active disease. Coronary calcium scores look at scars. So they don't really tell you if you have risk. They tell you if you have a problem. There's another level of looking at this called the Clearly AI, and there's another company, I can't remember what it is, but they use AI to analyze the data and tell you where the soft plaque is. Soft plaque is the risky stuff. Soft plaque is gooey, rancid pus gunk that when you have a stress event like anger or other trauma, or you eat a burger doodle with fries, you cause an arterial spasm, which causes the plaque to rupture, which causes pussy, gooey, sticky, nasty gunk to enter your artery lumen. It fills the lumen, the hole, the travel place where your blood goes through, with gluck that sticks there and stops the blood flow. If it happens in the place where it comes right off the aorta at the very top, that's called the left main, otherwise known as the widowmaker. You block that one, you lose 2/3 of your heart pump function. Boom, you're deceased. And so the key with this is, if you have high cholesterol and you're young, I wouldn't bother with doing any coronary studies. I would get on a diet and lifestyle program that reverses insulin resistance, because that is one of the causes. So insulin resistance can be caused by eating processed foods, eating pesticides and herbicides, eating too much sugar, too much alcohol, not exercising enough, having sleep apnea, and taking medications that cause your liver to junk up.
I have kind of a, from the far side, kind of a question. It involves scuba diving, and when you go down, real deep, like deep sea divers, they
Yes.
have the nitrox mixture, because the oxygen in your blood acts like a rusting agent. It causes friction.
Mm-hmm.
It can damage your arteries. Is there a way to use scuba diving or deep sea diving to kind of scrape the insides of your interior, deliberately try to increase the friction from the oxygen in your blood, just to kind of scrape the walls of your arteries to maybe knock some plaque loose? Or would you not recommend doing that?
Well, I guess the question is, do you want to die?
Well, no, I don't want to die, but
Right. So don't do crazy things like that. The way you reverse this stuff, your body has a natural mechanism for removing it. But in order to do so, you need to set yourself up to make the system work. So you need to eliminate insulin resistance. You need to exercise every day. You need to eliminate all processed foods. You need to eat like 8 servings of vegetables and 2 servings of fruits a day. You need to cut out the fried food completely. And increase your olive oil and fish oil intake.
Is it a danger that you could knock some plaque loose just by scuba diving too deep?
It's a danger to knock plaque loose or to rupture plaque and have the gooey stuff come out if you do anything that would cause an arterial spasm. So if you cause vascular instability by doing deep sea diving, you might induce it. I don't know. I've not read any information about that at this point. It could be a risk, because we know anytime you stress your vascular system, you're at risk for a vascular event, especially if you have a problem where you already have elevated cholesterol and maybe some plaque in your arteries.
Okay. And then if it's okay, I'd like to ask one question that's kind of off topic. It's about your last show where you were talking about alternatives to chemo and radiation. Would you recommend somebody that has brain cancer to do that first, not to just go straight to the chemo and radiation if it's recommended, but use those alternatives that you were talking about in your last show?
I think that they aren't really alternatives in that sense. What I was talking about in the last show, I think I mentioned using prior to doing radiation chemo surgery in people with prostate cancer, doing a high intensity focused ultrasound or a cryotherapy, which can be repeated, or you can then follow up with any of the other more invasive, more destructive treatments. But for this, there are no alternatives to doing body support when you have a disease. And so the oncologists, in their deep, benighted nature, will tell you stop taking all of your supplements because they have weird belief systems that make them think that these things are going to cause problems. But every study that I've read shows that when you take nutritional support and do other things, you actually enhance the chemotherapy or any other therapy you're doing. And for brain tumor, there's really good evidence that taking a substance called sulforaphane or glucoraphanin, SGS is another word for it, Oncoplex is the brand name for it. This chemical changes the way brain tumors operate. And in fact, when they combined, in one study I saw milk thistle with glutathione, the glioblastoma, which is the worst of the brain tumors, it actually shrunk. And then they did it with chemotherapy and it shrunk more. And so really, I hate to say it this bluntly, but you got to really kind of ignore the oncologist when they're talking about using supplementation while they're trying to poison your body. Because they don't use literature, they use belief systems to guide their negative edicts. In fact, on the National Institutes of Health Complementary Alternative Medicine website, there was a page which somebody removed that said IV vitamin C augments the chemo in several different cancers, and they published the studies right on there that showed you that it helped. And then it disappeared. It's the same way that when they did the review of homeopathic therapies, they found that it worked with a p-value of 0.000009, which said that's 1 in a billion that this is random. And then they said, well, we don't like some of the studies. So they took some of the studies away, and they said, well, now it has a p-value of 0.09, which means it doesn't work. So they changed what they looked at and said it doesn't work. This is the game that Western medicine plays to make sure that they have total control of you.
Yeah, their protocols, it's almost as if they're written in stone. But you can.
Well, they are. They're written in the blockheads of the people that wrote them. They're stones.
Yeah. Well, Doc,
they are the ivory tower. You can't get through it.
I want to thank you so very much. Your shows are always, incredibly informative, and I really appreciate you taking your time out to, educate us. Thank you.
I'm so glad to help.
Okay, well, goodbye, you guys.
Thank you there, Jack. Let's go to Gary in Clearwater. Good morning, Gary.
Well, hello and good morning, you guys.
Good morning.
I want to ask one simple question. I want you to give me your take on statins, okay?
Well, I think we just had a pretty good one. Statins work. They're not for everybody, and you only use them when you need them, and there's so many other ways to deal with cholesterol than with statin drugs. But if you've had a heart attack or a stroke, it really makes sense for at least a year after that event to take a statin because it reduces the risk of another one. Other than that, I'm not certain most people actually need them, but they're prescribed as the most prescribed medicine on the planet today, I believe.
Yeah, I had a stroke about a couple of years ago, and I've been taking a statin every day since. Should I continue taking it?
I think you should do exactly what your doctor tells you and continue to use a regimen that's keeping you healthy.
You got it. And all my blood tests show that.
Wonderful. That's exactly what we want. I wouldn't tell you to come off a medicine that's keeping you in a stable place.
Okay, thanks, Doc.
You're welcome.
And thank you, Gary. As always, you're a great caller, a great participant, and a great supporter of WMNF. And for the folks on out there, you are listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. And if you have any medical questions or concerns, we invite you to participate by calling 813-239-9663. Sage has come in specifically to answer your calls, and she has for Norm, and he's waiting patiently in the queue, and you can join him by dialing 813-239-9663 or continue to send your emails to dj@wmnf.org. Good morning to you there, Norm.
Hey, how you doing? Dr. Hart.
Good, Norm. What do you have for us today?
Oh, fine. This is a case that's a legal case. I don't know if you've heard about it. I just want you to take a look at it. There was a ruling that came out at the Fifth Circuit Court of Appeals on the governing of controlled substance medication by the Drug Enforcement Agency. And it totally changed the dynamic between the relationship between pharmacies and physicians and law enforcement. And I need you to take a look. It's called Newman v. DEA. And the Fifth Circuit ruled that the DEA essentially engaged in an act of rewriting their own laws, moving the goalposts backwards and forwards, and that much of what they were doing was inserting themselves into the practice of medicine. So I want you to take a look at this case, because this case affected me. In fact, I 4 years ago filed a case. It actually went before the United States Supreme Court, was docketed, but it wasn't granted cert. And it addressed these very same issues about the overreach and how farmers, the corresponding response, red flags, and those sort of things. And in fact, what the court said, the Fifth Circuit said just recently that these were all made-up terms by the DEA, and that they were using this as a way to go after pharmacies and physicians to collect more revenue. So I want you to take a look. I don't have any direct questions in particular, but just to inform you that, and I know you and I have talked about controlled medications, but it's called Newman versus Board of Pharmacy.
Yes, I'm looking at it right now, and I'm glad they rejected it, because honestly, I don't trust the DEA. I mean, the DEA is an organization along with our Congress that made cannabis illegal, yet they supported the opiate crisis that's still killing Americans. So I'm really not clear as to why they need to continue to poison Americans, but it's just the way our country works.
You're absolutely correct. In fact, when you go back and look at the history of this organization, particularly in the 2000s, you'll find that they directly supported the Karzai government, which we did, and the growing of that whole government was about narcotic trafficking and poppy growth, and that in fact, during the time that the Americans were in Afghanistan, growth of poppies, which then we derived the illicit heroin, went from 7.78 thousand hectares to 328,000 hectares.
Oh, so it's the way they fuel the wars, the jihad against capitalism.
Right.
Anyway, we should move on to health topics. I appreciate you.
Yeah, thank you very much there, Norm. Appreciate that. Let's go to Bill in St. Pete. Good morning, Bill.
Hi, Doctor.
Hi, Bill.
I'm 74 years old. I've been a non-dairy pescatarian for like 40 years. I work out every day. I take grapeseed supplements, magnesium, so on and so forth. My triglycerides are high. My LDL is high. And basically, I've made all the changes that you talk about. I don't eat processed foods. I've worked on my stress level. I have a CPAP machine for sleep apnea, and I'm not overweight. And yet, I've had a high calcium score. You mentioned that. And I've also been in and out of AFib. I've had a couple of ablations that may be related or not. But for somebody like me that made all these lifestyle and nutritional changes, and I am on a statin, and I just started, actually, he added in a Repatha, the injectable.
Oh, my word.
Yeah, I've just started it, so I'm hopeful about that for the LDL. My LDL's up around 190. But the fact that I've, what's left for me? I've already sort of done all the things that you're, recommending, and why are my numbers still so terrible?
Well, I don't know. I haven't evaluated you. And unfortunately, your doctors haven't either, because they would tell you why if they'd done deeper testing. There are tests you can do for where your cholesterol comes from. Boston Heart Labs does something called a cholesterol balance test, where they can see if it's being made more in your liver or whether you're absorbing more from your diet.
What's it called? Cholesterol balance test?
Yeah, from Boston Heart Labs. But now that you're on medication, it's going to actually completely skew that, because the injection and the rosuvastatin are going to significantly decrease the amount of liver production. And so you won't be really seeing the actual true nature of your metabolism. But the fact that you have 190 something LDL and you're on a statin drug suggests that you are one of the very few people that has a familial hyperlipidemia where you actually just can't not make it, and you may require that $40,000 a year injection.
Yeah, well, I just started that, so.
Yeah, so I think you do deserve a full metabolic workup because you are a pescatarian. So you may be eating a little too many carbs in your more vegetarian diet.
I'm cutting down on carbs, and I'm eating nuts and avocado.
Well, you deserve a full metabolic workup. It would be worth it for you to see a functional medicine doctor, because Western medicine doctors don't do metabolic workups.
Okay, well, that's a good. I'll look for this Boston test, I guess.
Yeah, look up ifm.org, Institute for Functional Medicine.org, and you can do a physician search in your area to see who's around. Because there's lots of, there's over 1,000 of us now certified.
And just one other question: does this stuff relate to atrial fibrillation? Is there a cause and effect about that? Because the heart has to pump hard.
Sleep apnea causes atrial fibrillation. Alcohol causes it. They're the two major causes. And there are some other things, possibly excess fish oil, possibly cannabinoids.
Oh, interesting. I don't do any of that, and I cut out the fish oil when I read the study about that and started eating anchovies and things like that to get my fish oil, which hopefully will help.
Choice.
But anyway, okay, thank you very much. I appreciate it.
You're welcome, Bill.
Yeah, thank you very much there, Bill. Appreciate you calling. And I'm going to make John wait a few more minutes patiently while I remind folks we're down to about the last 20 minutes or less of the Healthy Steps radio show. And I want you to have an opportunity to express your medical questions or concerns. Just give us a call at 813-239-9663. Once again, that number is 813-239-9663. And you can continue to send your emails to dj@wmnf.org. Good morning, John. How are you doing today?
Hello? Hello?
Hey there, John.
Hey, can you hear me?
Yes.
Oh, yeah. Hey, Doc, I'm 68, and I have a bubble on my elbow. I don't know if it's from working out or what, but I have had two doctors tell me they don't want to cut it open and drain it, or, and it's ugly, and I want it cut open and drained. So what do you think about that?
So it's a bursitis that's developed into an effusion. That's a collection of fluid in the bursa. Your elbow bursa gets a lot of use, and unfortunately, if you were to actually stick a needle in that and pull the water out, it will reaccumulate readily. And so the recommendation is actually stop doing the repetitive use injury to that arm, immobilize it for a bit, maybe put an ACE wrap on it, which will put pressure from the outside on the cyst, which will maybe cause some reabsorption of the fluid. But there's not an orthopedist or sports medicine doctor that will inject that if they actually are smart, because it will then be a constant draining problem for you and probably get infected.
Sure, that's what they all said, Doc.
Yeah. No, nobody actually ever sticks a needle in those. It would be a bad idea. So really, it's mechanical care. You need to actually calm it down. You might want to take some curcumin, turmeric extract, some fish oil, some boswellia, things like that can help to modify inflammation in your body. But resting it and wrapping it is a good idea.
Okay, all right, yeah. Well, everybody really needs to listen to you because I've been listening to you for a long time, and I haven't had a cold. I never got COVID, and I haven't had a cold in 7 or 8 years.
That's the way, man. Take care of yourself.
I keep my immune system good, and I take care of my body, So
I love it. Thank you, John. Thanks for listening, and I appreciate you.
All right, thank you. Bye.
Yeah, thank you there, John. Appreciate that. And with dropping you, we are now without callers, so it's about email time. But in that little void, I'm going to invite you to participate in the Healthy Steps radio show here on WMNF Tampa. Dr. Fred Harvey is here to answer your medical questions or concerns. Just give us a call at 813-239-9663. That number again is 813-239-9663. And for you shy ones, you can continue to send your emails to dj@wmnf.org. Well, what have you got for us, Doctor?
Well, Michelle wrote an email to us, and she's following up on the diving. And this is to the gentleman who is asking questions regarding scuba diving. As a PADI dive master and avid diver, I would recommend to the person who has respiratory or cardiovascular issues, however minor, or even if questionable, should not be diving. It's too risky. And she's right. The pressure changes, the oxygen changes, and the vascular changes that occur when you're under that pressure, it does stress it out. And it is recommended that you don't do it without real good clearance from a sports doctor. Actually, a cardiology sports doctor would be the best. Here's another one following up on my initial discussion about cannabinoids. So does eating organic shelled hemp seeds aid the liver? Well, hemp seeds are the ones that contain CBD, not THC. Some are actually grown for higher amounts of CBD in the plant. So you might want to actually, to get the doses, you might want to be taking 25, 30 milligrams a day. But eating shelled hemp seeds is great fiber, great oil, great minerals, worth eating. But you may need more to actually evoke a clinical change. And so I get full spectrum extracted hemp tincture. They press the seeds and make a nice clean oil. And I do generally myself, I do about 0.5, like half a milliliter, which is around 50-ish milligrams a day, because I want the anti-inflammatory effect. It's just smart, I think. And I do throw hemp seeds in this and other things. I really try to eat such a wide variety of foods because my microbiome's happier with it. I think I've mentioned it before. If you eat 35 different plants in a week, your microbiome is the happiest it can be. I think we have a caller.
Indeed we do. We've got Dale on the line. Good morning to you, Dale.
Yes, sir. How are you today?
Doing great, Dale. How are you?
Well, I'd like to say I'm doing great, but I'd also like to ask you something about the stool samples. I know that you, on a previous broadcast, you said that there's only a parasite test that 1 in 100 or 1 in 1,000 the regular MDs do. I know that I've tried to get the test done, and they kind of all they want to do is the mail order thing to tell whether you've got cancer, and I've already think that that's already a done deal, and they refuse to kind of give a regular parasite test, and you said that there was one that they normally don't do. Could I ask what that is and expound on that a little bit?
Sure. I don't really do a lot of, I'm not looking for parasites. I've not found a lot. I've not treated a lot because most people don't have them in America. The water's pretty clean, and I have found that the ones that show up in people's stools generally are low-level non-parasites. They're more commensal organisms. They kind of like pass through your gut. Things that sound bad, like Dientamoeba fragilis. It sounds like amoeba, but it's not the one that causes dysentery. And so they show up in people that are already sort of ill. The stool test that I'm talking about is actually a metabolic and microbiome test. So when you go to a gastroenterologist or a primary care doctor and you say you have loose stools, they might do a pathogen stool test, which looks for the organisms that cause diarrhea. They don't look at anything else. The stool tests that functional medicine doctors do, and there's several companies around that do them, and each one has a slightly different style. My favorite one is done by Genova Laboratories or Genova Diagnostics in Asheville, North Carolina, because they actually do both a genetic evaluation of the microbiome and they do a culture evaluation of what's growing there. So they look at the organisms that are supposed to be there in big families and see whether they're full or not. So you can see if you have overgrowth or undergrowth, missing species. Missing species leave holes, and these holes get filled in with the wrong things, like the low-level parasites that aren't really parasitic but fill in the spots, the other bacteria that you don't need, but they fill in the holes. And so the microbiome test that I do looks at those things and sees the dysbiosis, meaning wrong growth, the upset families. It also looks at the chemicals of your digestive metabolism. So it'll look at the enzymes coming from your pancreas, the acid in your gut, the products of protein breakdown from the food you eat, the products of fats breakdown from the foods that you eat. It'll look for inflammatory markers like antibodies against other organisms. It'll look for inflammatory markers like calprotectin, which can tell us if you have a predisposition to cancer or to inflammatory bowel disease. It looks at the chemicals of metabolism of the microbiome to see if it's actually strong enough to be metabolizing and creating the chemicals that your gut needs to grow. And that is the short chain fatty acids, butyrate, acetate, and propionate. And so when I look at a stool test, I know what's going on in your gut. When a gastroenterologist does an endoscopy, he knows what your gut looks like. I want to know what's going on there. I don't really care as much about what it looks like because it's how it's functioning that matters to me. And so I get all kinds of information from doing these broad-based stool tests to figure out what's going on in your gut to enable shift. Because there's so many things you can do that don't involve just taking some antibiotic or something to shift what's going on there. You know, if you have some of the wrong bacteria growing, taking a nutritional yeast might actually shift the whole equation rather than treating with an antibiotic. And so you really need to look for a doctor who's willing to actually look at you and not just do the cookbook. So you might need a functional medicine consultation to find somebody who's willing to look at a broad stool test and understand it. Because I've tried to get a gastroenterologist in Sarasota to actually look at this stool test with me, and they throw people out of their office. Or they just laugh and say, okay, maybe someday we'll talk about that. But I haven't been able to educate any of the local gastroenterologists about what these tests actually mean so they can help their patients.
Well, that's exactly the problem. And the numbers, like on the CBCs, it says, those numbers are, they always say, well, your numbers are good. But, what does that mean? It doesn't mean that that's, you're, like you're saying, they don't really get into it and actually look for the cause of things. You feel great, or you don't feel so good. Your numbers are great, but you don't feel good.
Right. So what those numbers really mean because they're looking for illness. If you don't have the numbers show up for what they're looking for, it means you're not ill. It doesn't mean that you're healthy, because the entire world of Western medicine is focused on labeling and treating illness. So if you don't have one, you are not healthy, you're just not ill. So there's nothing for them to do for you. So they tell you to go away and come back when something develops so that you can actually have a label that they can throw things at.
Exactly. And even if you have a condition that, like cancer used to be 1 in, 20, now it's 1 in 2 or something, but they diagnosed me with that too. What do you actually, in your colorectal cancer, what do you actually, what can you do to actually stop it instead of all this standard of care, the chemo, radiation, and surgery?
Well, if I had a colorectal cancer, I would let them cut it out, because I don't want that tumor burden. Once it's gone, or while it's being treated, I would be doing everything I can do to turn back the metabolism of cancer in the body. I can tell you that Dean Ornish published data on it. If you go to ornish.com, you can read what he has about turning back the cancer genes associated with prostate cancer. They're all the same genes. They're all inflammatory genes. They're all poor metabolism genes. And when you exercise 30 minutes a day, eat a high plant-based diet, like 8 servings of plants a day, and you meditate or do stress reduction every day, you turn off the cancer active genes. You turn on the anti-cancer genes. So there's really simple things that everybody could be doing, but nobody is told this at the time of diagnosis.
Right. Yeah, I appreciate your help. And, just talking to somebody that you think that, they act like you're not crazy, it does help. So thank you very much.
You're very welcome. So we have some emails. Homemade water peroxide mouth rinse safe. Well, I don't know how you'd make peroxide. I would just get a bottle of hydrogen peroxide and do it 50-50 with some water, do a quick, or even 30-70, just a quick rinse. It is okay. I don't do a lot of that. I don't think I need the oxidative stress in my mouth to clean it out. I just brush and floss. Let's see. This one, Greg asks, what's the name of the lab in Asheville? That's Genova, Genova Diagnostics. Great company. They have huge amounts of education online about why they do what they do. And they are a Medicare CLIA federal government certified lab, and they have achieved the American College of Pathology designation as a superior lab. They know what they're doing. And I trust them. And I know that I get results when we look at the information that this lab and others like it provide functional medicine doctors to enable you to look at your function so that we can work on you and your health rather than simply treating diseases. And last email, I just had a Widowmaker fixed with a stent. That's brilliant. And it was just put on Repatha. That's the injection for cholesterol. Brilliant to do because the statins aren't working for this person. That's why she ended up with a Widowmaker. In any event, this has been a great hour. Thanks a lot for everybody's input. I really appreciate you all. And thank you, Bill, for being there on the boards. Joe, next week I hear. And thank you, Sage, for answering those phones.
And thank you, Dr. Harvey, for another informative and rewarding Healthy Steps radio show. And thanks to all of our participants, listeners, and supporters. You make this show exemplary. And Sage, thank you for answering the phones today and all that entails. This show would not be possible without your assistance. You have been listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. Waiting for you like a dear friend is 5 minutes of NPR headline news, and then get ready for the Sustainable Living Show, hosted today by Annie Ellis. So until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, stay thoughtful, and know that you are loved.